So persons who have diabetes must do extensive monitoring of their diabetes condition, self-monitoring of blood glucose. You probably see TV commercials for all the glucose meters. That's done multiple times per day, typically 3 to 4 times. Oftentimes you can get the meter for free, but where the cost is involved in getting the test strips. So the meters are often free, but the strips are not. Then there is something called glycosylated hemoglobin, and you might see this abbreviated on someone's physical exam blood work as hemoglobin A1C. And so what this is a more longer term management of glucose control over the past 2 to 3 months. The levels should be below 6%. I've also seen 7%, but that gives a better indication of how well somebody's managing their diabetes. So they can say, oh yes, I monitor my glucose and I do all the things I'm supposed to do, but their hemoglobin A1C may indicate otherwise. Complications from diabetes, and I'm sure a lot of you are familiar with these. Hypoglycemia, so blood sugar gets too low. So what can cause that? Someone had too much insulin, they've had too little food, they've had too much exercise. Exercise acts as a natural insulin, so they have to keep carbohydrate foods close by. Ketoacidosis, metabolic acidosis. If the blood pH goes too low, it can lead to circulatory collapse. That's going to be far more common in people, especially with type 1 diabetes. Skin problems, infections, ulcers, diabetic retinopathy, blindness, which is a leading cause of blindness. As we learned the other day about the kidney disease, diabetes is a leading cause of kidney disease. Heart disease, as we mentioned, it really, the increased blood glucose increases the LDL, and many people with diabetes also have hypertension, so they also will get damage to the endothelium as a result of that. Neuropathies, numbness, tingling, pain in their feet, and so that can lead to problems and decreased circulation, and amputations are common if people lose circulation in their feet. Management of diabetes, it's a lifetime process from the time the person is diagnosed. They have to really be consistent in food and exercise and medications. So some people, even though some of those people who have type 2 diabetes, they may still use injectable insulin. Eventually their pancreas are going to burn out and stop making insulin. They're still considered to have type 2 diabetes though. So they may still use injectable insulin even though they have type 2 diabetes. And then there's the insulin pump that makes people feel more normal. Halle Berry has an insulin pump that she wears. She's probably one of the famous celebrities who have diabetes. We also have a student in our program who has diabetes, and he wears an insulin pump, and he said it really makes him feel more normal because with the injectable insulin several times per day, your blood sugar will go up and down, and the pump actually acts like a normal pancreas, and it works on a negative feedback just like the body would. So it makes people feel a little bit more normal. Now of course there's always a risk of infection of where the insulin pump goes into the skin. And of course there are many medications, especially people with type 2 diabetes can take. So look in your text, your chronic disease text, the ACSM guidelines. Some of them work in different ways, and some of these are more familiar maybe by their brand names than their generic names. And generic names can be a little tricky. Sulfonylurea stimulates beta cells and inhibits glucagon. So sulfonylurea is the type of drug. That's the generic name, and then the brand name for that is Glucotrol. So it tries to stimulate what little insulin production is left. Biguanides, decrease liver glucose production, so it reduces gluconeogenesis. Metformin is the common drug. That's a very common drug. We'll talk about that with the Diabetes Prevention Project. Glucosidase inhibitors, so they decrease glucose absorption out of the intestine, small intestine particularly. And thiazolidinediones increase insulin sensitivity in the cells, in healthy cells, and they also limit glucose production in the liver. And that's another drug called Avandia. So you probably have seen commercials for maybe some of these, Avandia, maybe metformin, but these are some of the most common drugs. So people who have diabetes, they may be on one of these or they may be on multiple types of diabetes drugs.